Gentlemen, today I want to speak to you with total frankness. Imagine that you could stimulate a hidden point on your own body for just 60 seconds, and with that experience again firm and powerful erections that many believe are lost forever. It's a natural method that restores blood circulation, returns sensitivity, and above all strengthens confidence. And the best part is that it works at 60, 70, or even at 80 years old. My name is Dr. Theodore Chambers. I'm a urologist and men's health specialist with over 20 years of experience accompanying older men who want to regain their vitality. In my practice in New York, I've had thousands of confidential conversations with men who notice with frustration how their intimate strength is declining. Many believe that when potency diminishes, there are only two options: pills or resignation. But that's not true. There's a point on your own body that almost no one talks about, a place recognized for centuries in traditional medicine. Today, modern science confirms that this point has the power to activate circulation, improve nerve health, and strengthen the entire pelvic floor area. I make you a promise. If you massage this point just 1 minute a day, you can promote blood flow, relax the pelvic floor muscles, and awaken the systems that produce firm erections and lasting vitality. In a few moments, I'll show you exactly where it's located, how to find it, the right way to stimulate it, and what natural oils enhance its effectiveness. Before continuing, subscribe to the channel and activate the bell. Don't miss any of my health tips designed for men in their best phase. If this message resonates with you, write a 1 in the comments. If you feel it doesn't contribute, write a 0 so I can improve. Now, before showing you where this powerful point is located, we must understand what changes in the body after 50. The erections that used to come effortlessly begin to lose intensity. Not because masculinity disappears, but because certain internal processes gradually reduce circulation, nerve sensitivity, and muscle strength. Let me speak with the same honesty I use in my practice. I've seen it in hundreds of men. At first, everything seems to work as always, and over the years, almost without noticing, the changes infiltrate. What was once firm and reliable suddenly becomes uncertain. Sometimes it only sustains halfway or doesn't appear at all. And it's not just about intimacy. It touches confidence, the way you perceive yourself as a man. Many confess to me that they feel as if a part of their identity is slipping away. But I want you to understand something fundamental. You're not alone, and it's not your fault. The reality is that after 50, the body goes through very concrete changes. One of the most important affects the pelvic floor muscles, responsible for both urinary control and erections. These muscles become simultaneously tense and weak. It may sound strange, but imagine a rubber band that's been stretched too long. It seems tense but has lost strength. Exactly that happens in your body. Secondly, there are the blood vessels themselves. Over the years, they lose elasticity, become harder and narrower. Blood no longer reaches the penis as easily and quickly as in youth. Erections depend on intense and rapid blood flow. When vessels can't dilate, firmness and duration are affected. Thirdly, the nerves in the pelvic region begin to be compressed. Years of sitting too long, stress, poor posture, and even scars from previous inflammations end up compressing the pathways where sensations travel. The result is dampened sensitivity, less arousal, and slower responses. Perhaps you're thinking this sounds like a hopeless combination: weak muscles, rigid vessels, and compressed nerves. But here I want you to pay close attention. That this is common doesn't mean it's definitive. These problems aren't a life sentence. In reality, they're signals your own body sends asking for help, stimulation, and restoration. The surprising truth is that there's a very concrete point on your body, hidden in plain sight, that when massaged correctly can reverse much of this deterioration. It's a zone that most men never pay attention to, but that holds the key to reactivating circulation, nerves, and strength. Now that you understand why the body changes after 50, I want to show you something almost no one talks about. There's a small hidden zone that directly influences erections, prostate health, and even bladder control. This zone is called the perineum, known in traditional medicine as the million-dollar point. It's located exactly between the scrotum and the anus. I'll be honest, when I started practicing over 20 years ago, I also didn't give much importance to the perineum. Like many doctors trained in Western medicine, my focus was on medications and procedures. But over time, listening to my patients and observing how their bodies responded, I understood something powerful. This forgotten point is like a secret crossroads where several highways of male health converge. Under this small strip of skin pass fundamental blood vessels that transport blood to the penis. Next to them pass essential nerves that transmit arousal and pleasure signals to the brain. The root of the penis anchors precisely here, and just above is the prostate. All these elements concentrate in a space smaller than the palm of your hand. When circulation slows down, nerves lose sensitivity and muscles tense. It's exactly at this crossroads where problems accumulate. And here comes the surprising part. When you apply a gentle and constant massage on the perineum, you can directly influence all these systems at the same time. It's like sending your body a clear signal. Wake up, free yourself, and let flow. Many men who begin to stimulate this area describe the experience as if suddenly an internal congestion in the pelvis dissolved and everything flowed freely again. Here's where everything becomes really practical. It's not enough to know that the perineum is important. The essential thing is to learn how to locate it and stimulate it correctly. Imagine this moment as if I were with you, guiding your hand calmly. The perineum is found in that small strip of skin located exactly between the scrotum and the anus, right in the middle. Imagine dividing that area in two halves. The point is exactly in the center. At first it may seem strange because it's an area that's rarely given attention, but with patience you'll recognize it. When you press gently with your fingertips, you should feel a slight indentation, soft but sensitive, even delicate. That sensation of sensitivity isn't a sign of damage. On the contrary, it's confirmation that you've arrived at the right place. Once located, the technique is very simple. Put your index and middle fingers together and use them to apply constant and moderate pressure. Imagine as if you were squeezing a ripe tomato, firm enough to feel its consistency, but gentle enough not to crush it. That's the ideal pressure measure. From there, make small circles clockwise for 30 seconds, and then repeat counterclockwise another 30 seconds. This 1-minute routine is normally sufficient to improve circulation and release tensions. Some men prefer a gentle up and down movement, as if bouncing lightly on the point. Others alternate firm pressure for 5 seconds with relaxation for another 5, creating a rhythmic pumping that stimulates blood flow. The important thing is to understand that it's not about applying excessive force or forcing immediate results. Too much pressure only leaves discomfort. Think of this less like a physical exercise and more like a friendly invitation. With practice, the movement becomes almost automatic, and soon you'll notice how your body begins to respond. More warmth in the area, a sensation of relief, and even a gentle pulse indicating that fresh blood is circulating again. The most valuable thing about this technique is its simplicity. You don't need special tools, expensive treatments, or complicated instructions. Just your own hands, a comfortable position, and the willingness to gift yourself 60 seconds of conscious care. And although you can do the massage without additional aids, there's a way to make it much more pleasant and effective, using suitable oils. After years of working with men, I've discovered that the right oil completely transforms the experience. It's not just about reducing friction. The oil opens additional layers of healing, improves circulation, calms inflammations, and nourishes tissues neglected for years. I clearly remember a gentleman over 70 who came with doubts. He tried it dry for a week and admitted it felt uncomfortable and ineffective. When I suggested adding oil, everything changed. In a few days, he noticed more warmth, better flow, and general well-being. So what oils are really worthwhile? At the top of my list is castor oil. It's been used for centuries for its extraordinary ability to penetrate deeply. It contains ricinoleic acid, a compound that simultaneously calms inflammations and stimulates circulation. Many men describe a pleasant warmth sensation after application. Another excellent option is coconut oil, especially virgin. It's my recommendation for sensitive skin because it's naturally antibacterial, soothing, and easily absorbed without leaving greasy residues. Plus, it contains compounds that promote hormonal balance and reduce mild inflammation. For those seeking something more potent, black seed oil is another outstanding alternative. It contains thymoquinone, a compound that studies link with better circulation and support for testosterone production. And if you want to take this practice to a higher level, you can mix them and even add a few drops of essential oils. Peppermint oil stimulates circulation. Rosemary oil awakens nerve activity. And sandalwood oil is traditionally associated with male reproductive health. Remember that essential oils are potent. 3 or 4 drops per 30 milliliters of base oil are sufficient. When you understand what happens in your organism, everything begins to make sense. The first effect is improvement of blood circulation. When you exert pressure and gentle movement on the perineum, you act like a kind of pump. You help stagnant blood leave the tissue and make space for new oxygen-rich blood to enter. Secondly, you reactivate nerves that over time may have become slow. The nerves that transmit arousal and erection signals pass directly through the perineal region. When tense muscles compress them, those signals lose strength. The gentle massage decompresses them and allows messages to travel clearly again. The third benefit is that this massage indirectly supports the prostate. This organ is located just above the perineum, and when circulation improves in the area, the prostate also strengthens. Better circulation can reduce congestion, promote hormonal activity, and even relieve urinary symptoms. Finally, this massage releases pelvic floor tension. These muscles can overload and harden, just like those in the shoulders. When you release those tension points, the entire pelvic system functions with more smoothness and strength. And there's another effect, the impact on the nervous system. This massage activates the parasympathetic nervous system, the part in charge of relaxation and recovery. In that state, stress hormones like cortisol begin to drop. A common question is, "Doctor, what time of day should I do this massage?" It's logical because time and consistency change everything. Mornings are an excellent time. That's when testosterone levels reach their peak. When you massage the perineum shortly after waking, you take advantage of the natural rhythm of your hormones. Many men who practice in the morning report feeling more vital throughout the day. Evenings also have advantages. A 1-minute massage before sleeping helps the nervous system enter deep relaxation. It reduces stress and can improve both the quality of nighttime erections and morning stiffness. At the beginning, I usually recommend starting every other day. This way, the body adapts without causing irritations. After the first week, most can do it without problem once a day. And those who truly enjoy the benefits often move to 2 sessions with even greater results. It's also worth mentioning that if you're planning an intimate encounter, doing the massage about 2 to 3 hours beforehand is usually most effective. I've accompanied men of 60, 70, and even over 80 years who after a few weeks return with reports that repeat constantly. One of the first changes many notice is better bladder control. That discomfort of drops remaining after urinating and the constant nighttime trips to the bathroom begin to noticeably reduce. I remember a patient of almost 70 from Chicago who told me he went from getting up 4 times a night to just once. His wife was also happy because they could finally sleep through the night. Another unexpected benefit is relief from chronic pain in the pelvis. or lower back area. The pelvic floor muscles are connected with the hips and lower back. When these muscles are rigid, they pull on everything around them. When you release that tension, the pressure is relieved. I'll never forget a 72-year-old gentleman from Boston who told me his hip pain that had accompanied him for 5 years completely disappeared after 3 weeks of constant practice. There are also men who report more stability during exercise, more endurance and faster recovery. Even mental clarity and mood are favored. Stress hormones drop, circulation improves, and a sensation of lightness and renewed vitality comes. The biggest challenge of any health practice isn't learning what to do, but maintaining it long enough to enjoy its benefits. The truth is that this technique doesn't work like a quick fix, but like a daily ritual. The first step is to connect the massage with something you already do regularly. It can be right after the morning shower, before shaving, or when going to bed. When you link it with an existing habit, it becomes automatic. Many men have told me that keeping a small bottle of oil on the nightstand was the decisive change that allowed them to maintain consistency. What isn't seen is often forgotten. It's important not to fall into the perfectionism trap. You don't have to do the massage at exactly the same time every day for it to work. If you forget one day, simply resume. What really counts isn't rigid rules, but consistency over time. The goal is to see this massage as a prevention tool, not just as a remedy when there are already problems. Even if today you're satisfied with your performance, introducing this routine will help you preserve your potency, energy, and vitality as you age. At the end of the day, it all comes down to a simple decision. Do you accept deterioration as an inevitable consequence of age? Or do you decide to take an active role in keeping your body strong, vital, and full of life? I've seen countless men who felt defeated because pills didn't give lasting results. Many believed their best years were behind them, and yet when they adopted this daily 1-minute massage, something surprising happened. They began to feel they were regaining control. Taking care of your potency doesn't mean chasing lost youth. It means protecting your dignity, your intimacy, and the confidence of knowing your body can still respond when you want it to. This simple gesture, 1 minute a day pressing a point, is like preventive maintenance of your masculinity. It's not flashy, it's not expensive, but it works and returns power to your own hands. I often think of a patient of almost 80 from Philadelphia who came resigned, convinced that intimacy belonged to the past. After 30 days of constant practice, he told me with tears that he had not only improved his physical function, but had recovered the emotional connection with his wife. He told me, "Doctor, I feel like myself again." That's the true promise. It's not just about firmer erections, but about a fuller life, lived with joy, confidence, and closeness. Now the choice is before you. You can continue trusting in quick solutions, or you can dedicate just 1 minute each day to nourish your body, improve your circulation, and regain your confidence. The investment is minimal, but the reward can be extraordinary. What I want you to remember is simple. You're not helpless. With just 1 minute a day, you can recover not only function but also dignity and confidence. The decision is literally in your hand.